I have like about 3 minutes of updates, and basically, as you know, like the Consolidated Appropriations Act of 2023, which passed December in 1922, extended the all of the Medicare telehealth flexibilities through the end of 2024. So basically, the geographic limitation was lifted. Telehealth can be provided any place in the United States. The site of service limitations were lifted. The patient can be at home, and certain physical therapists, occupational therapists, speech language pathologists, and medical nutrition therapists were added temporarily as possible distant site practitioners for telehealth. So all of those waivers remain in effect until the end of next year. Um, as far as additions to the permanent additions to the Medicare telehealth list, only one service was added. The new service G0136, which is a standardized risk assessment for social determinants of health. And one other change, and this was also from the Consolidated Appropriations Act of 2023, is marriage and family therapists and mental health counselors are now independent practitioners under Medicare, and they're added permanently to the list of distant site practitioners for telehealth services. The changes regarding place of service on professional claims for telehealth going to go into effect in 2024. In other words, for services rendered to patients in their home. On the generally speaking, the place of service now should be 10. And it identifies a telehealth service rendered to patients in their home. And these services will be paid at the full rate, the non-facility rate under the Medicare physician fee schedule. Um, uh, One little wrinkle is for the services of, the practitioners added temporarily to the Medicare the list of distant site practitioners, physical therapists, occupational therapists, speech language pathologists, and medical nutrition therapists. They ask that beginning in 2024, you use the modifier 95 to indicate that the service was rendered by telehealth. And the other thing that I will mention is that although the rule requiring an face-to-face visit 6 months before a telehealth service for mental health, that rule has been paused by the Consolidated Appropriations Act until the end of 2024. It goes into effect on January 1st, 2025. So if you've been continuously providing telehealth services to a mental health patient, I would recommend that in the latter part of this year or latter part of 2024, you provide an in-person service so that you can continue to be paid for telehealth services after January 1st, 2025. And that's my spiel. I'll take any questions.
Thank you so much, Tony. So as a reminder to all of our participants, like I mentioned just a few moments ago, we don't have any state representatives to provide any updates today, but I will be sharing with the notes a slide deck that was presented at our September North Country Leadership Summit, where our state partners from DOH, OMH, and OASAS gave some policy updates and discussed the current regulatory rules that each office is currently following. So I will be sending those slides around with the notes for your review. And if there are any other updates that I receive, I'll be sure to email those along as well. If there are any questions for Tony, feel free to add those to the chat. But for now, we'll move right into our presentation by Dr. Linda Collins. And please add in any questions to the chat during Linda's presentation as well. And after that, we will move into Q&A and talk about a few other updates about telehealth to share. So without further ado, Dr. Collins, please go ahead.
And good afternoon to everybody. Thank you so much for giving me this platform and opportunity to present this work to you. I did want to put on my camera so you can see me, that I am a real person, but I will turn off my camera so I can focus on the presentation. So thank you very much once again. Okay, so I'll just give you a brief background about my role and what I do and where I've come from. So I'm originally a nurse by background. I've been a nurse for nearly 18 years or so in the United Kingdom. I'm from London originally, and most of my work has been focused in community health. And when I did qualify, I went straight into the community to look after those with chronic conditions in their homes. And then I later migrated into research and evidence-based practice. And whilst I was working in research, I was a research nurse for a clinic that focused on urinary tract infections and continence. So everything to do with the bladder, that is what I focused on. And these are people and patients with chronic bladder conditions. So we saw many of them in the clinic, and also we had teleconferences as well. And that was my real insight into telemedicine and telehealth working in this clinic, because we had lots of patients who were coming to us from nationally and internationally all over the world for this clinic for their bladders and treatment. So this was a real eye-opener to learn more about telehealth whilst in this role. Then I now migrated to the US, where I am now at Southeastern Louisiana University, and I am the graduate coordinator for a master's program, which is Population Health Management. And this is 100% online. And in this program, we look at telehealth, we look at different management strategies with those with chronic conditions. We look at how we can manage different conditions from an interprofessional approach. So there's various different aspects of learning that takes place in this graduate program. So as I said, it's a master's program, it's population health management. And most of the students that come onto this program are qualified practitioners or those who've had an undergraduate degree in some type of health-related field or health management. And we have seen registered nurses and allied healthcare professionals, those who work in data management or informatics that come onto this program to enhance their knowledge and understanding of how to manage a population with chronic conditions. And when they come onto this program, they have the idea that they are going to graduate and get careers as listed here. And in most cases, they do. So those students who've come onto the program have graduated, they've become population health coordinators, directors, managers, and they're working with telehealth in rural areas of Louisiana and also in clinics and community settings. So there is an array of different career opportunities that students obtain when they complete this program. So we have to prepare our graduate students to become population health management workforce developers and also workforce practitioners. And in the program, because it's 100% online, the students don't get to physically see themselves. It's important that we cultivate this idea of critical reasoning, critical judgment, and insight. And that's where we look at online discussion forums where students have the opportunity to discuss critical topics and debate them from evidence-based perspectives. And remember, these are different students from different backgrounds, from social work, allied healthcare professionals, nursing. They all come with different evidence-based knowledge, and they come together to share their perspectives on managing populations with different conditions. Now, when it comes to online academic discussion forums, there's been this insight and this concept that it creates higher level critical reasoning, and the students become more conceptual thinkers. They become more creative with the way in which they analyze scenarios or analyze topics. And it's also been this talk about it being an engaging catalyst for dynamic interaction. Now, there has been this talk about discussion forums being dull and dry and not enthusiastic, but we have to challenge that concept by looking at different ways in which we use it, and which is what is embedded within this program. And there's also been this idea that online discussion forums generates new information, creates dialogue, it demonstrates leadership qualities amongst students, and it elevates conversations from critical perspectives. So this is what we like to see, and this is what we need when we're developing a workforce. So I did a retrospective evaluation of this, and the objective was to explore whether graduate students undertaking the master's program in population health management recognize the strengths and limitations of telehealth, with a focus of confidentiality as a debatable topic. Now, a lot of the students who come onto this program, they have got some type of experience with telehealth or telemedicine or some type of remote management of health. And the concept of confidentiality is a big concern, especially during the time of COVID, when we had to really migrate to telemedicine by force due to the nature of what we were experiencing at the time. So the participants of this evaluation were obviously the graduate students on the master's program, and they were undertaking a course which was on health informatics. Now, health informatics is focused solely on digital health, digital technology, and telehealth. And it was part of the master's program. And these students had experience of telehealth or telemanagement to some degree. And a debatable question that was presented is, can telehealth maintain confidentiality during COVID? And it was a prime example because that was the time this was taking place. And we use Moodle as the learning management system. That's the system we use here for teaching and learning. And the discussion forum was pasted within Moodle for students to access it. Please do bear with me. There is a train passing behind me if you can hear it. I'm in Hammond and there's a train that passes by, so just in case you hear it. So also the learning management system was also asynchronous. It was an asynchronous online discussion. So students were able to jump into the online discussion forum at different times. And these students are in different locations across the country and internationally as well. So obviously the time difference will have an impact, but it was there for them to utilize and to get involved with the discussion. Now, the retrospective evaluation was conducted in the spring semester of 2021, so COVID was still happening then. And the data which was collected was the students' discussions using the online discussion forum. Now, I didn't actually look at what they were saying, but I was looking at the interaction of the discussion forum, how well they were utilizing it, how well it was being used for teaching and learning, and whether or not the students were engaging in the topic that was being debated or discussed. And the data analysis was focusing on the performance of the interaction and the active participation, and the systematic evaluation of the discussion forum interaction, and also the evaluation of frequency and depth of the interaction. Because, you know, some students, when they're on discussion forums and their peers are commenting, they may say, oh, I agree with Sarah, oh, I agree with Tom, but not really getting involved in the discussion, which is what they're supposed to be doing. So that is why we were looking at evaluating the frequency and depth of student interaction in this particular point. And also manual coding or student interaction. So seeing how many times a student would post a discussion, how many times they would respond to a comment, how many times they would interact. So that was the manual coding. And for this project, we had to get an IRB approval from the university, which was obviously approved. So the results of this evaluation was that within the first 24 hours, there were 44 asynchronous responses. And these are asynchronous responses based on a question that had been posed to the discussion forum. And there was evidence that there was immersive online learning and interactive dialogue, which was regarding the strengths and limitations of telehealth, okay? And what we did find out was that there was intelligent critical discussions. The students were able to actively discuss and debate what they thought was a strength or limitation relating to telehealth and confidentiality. They were also able to bring in their own personal experiences of data breaches from what they had experienced in their personal lives and also in their professional lives, which was good. And there was also critical scrutiny of the responses. So for instance, a student would post something and say, I agree with this or I believe this. But then another student would come in and critically antagonize that perspective with evidence-based literature, which was a fantastic way of them really engaging in a discussion and debate. And there was also this immersive and active online learning whereby students would upload literature, evidence-based literature to defend their topics. They would upload reports that would say, this is what is happening and this is what should be happening at that particular time. So there was a good way of independent peer interaction. There was also feedback, real-time feedback from their peers, as the peers would say what they mentioned was good, what was not good, and also get feedback from the instructor, which was an excellent way of getting feedback, instant feedback during the process of critical discussion. Now, with any type of evaluation or study or research, there's always going to be some type of limitation. And there were limitations with this evaluation. Now, what it was is that there wasn't the opportunity to explore students' perspectives or utilizing the online discussion forum for discussing the topic. And that's an important element because it's good to get students' feedback as to how well the platform was used in order for them to critically discuss the topic. And also to identify whether the discussion forum was appropriate for this type of discussion or topic being discussed. And it would have been good to highlight that from the students' feedback. And whether or not the discussion forum facilitated effective peer learning for themselves, because I can see that there was some type of effective learning from an instructor's perspective, but it would have been good to see what the students felt about the whole process. So that's something that could be looked at another time. So just to summarize what we did in this project, it was good that discussion forums were embedded within online learning, and it was a fundamental way of engaging students. And students developed different levels of critical reasoning when discussing topics relating to population health management, in particular telehealth and confidentiality, which is a major part of what the students explore within the program. And it promotes interactive discussions and debate, which we had seen in the evaluation, that there was this independent critical evaluation of what their peers were mentioning and the support of evidence-based literature. And it also gave students the opportunity to get peer feedback along with reflective practice as to how well they performed in the discussion forum and how well they contributed with the evidence-based knowledge or the critical debate that they were presenting at the time. And these are just some of the references which I used to put this presentation together. So thank you very much for this opportunity once again.
Thank you so much, Dr. Collins. Please, if anyone has any questions, feel free to add those to the chat. I don't see any yet, but I have one to start. Yeah. I'm curious to hear about how you anticipate telehealth and virtual care being integrated into different programs like the population health management, public health master's programs, things like that. I think historically it hasn't been included very often, but curious to think if you think it will be more integrated in the future.
Absolutely, and I think it needs to be integrated because it's a fundamental part of managing patients with chronic conditions in a community setting, in rural settings, and nationally. And with this program, I set up the curriculum from scratch. And it wasn't a daunting task because I knew what I needed to put in this curriculum based upon my experience of working in community settings based upon using telehealth and telemedicine to manage population groups. So it was an important factor that this was embedded within the curriculum. And it was also important that students get to have an understanding of it, especially for those who are graduate students coming into a workforce where they'll be managing populations of different groups, different ethnicities, different diversities, everything. So we need to make sure that there's an incorporation of telehealth to make sure that when we are looking after these population groups, we're utilizing every source available to manage our population effectively. And that's what the students need to know before they graduate and go into the workforce to be population health practitioners.
Thank you. And again, we have, about 30 more minutes for the Learning Collaborative. So if anyone has any other questions, feel free to add those to the chat. But for now, I could go into some other updates to share, but just want to thank Linda again for joining us today and for sharing this research. So as I had noted in the agenda that was circulated, there are a few updates. You might have all seen that the Drug Enforcement Administration, along with DHHS, has extended the full set of telemedicine flexibilities regarding prescribing of controlled medications through December 31st of 2024. They were hosting some public comment sessions back in, I think it was September or October, and then finalized that ruling. So there's some more details about that will be included in the notes. Also in the agenda in the notes, I have linked a new SDOH toolkit that was created by the advisory group on using telehealth to eliminate healthcare disparities and inequities. And this was developed as a framework with materials to address healthcare gaps that can be mitigated utilizing virtual healthcare. So it's a great resource to take a look at if you haven't yet. And then I wanted to take a few minutes to plug the New York State Connect All office. That's previously known as the broadband office for the state. Over the past year or so, they've been working on drafting some plans. One is their BEAD plan, which is the Broadband Equity, Access, and Deployment Plan. And they had a 5-year report recently published, which outlines the goals and priorities for the millions of dollars that will be allocated for broadband deployment in New York State under the bipartisan infrastructure law. So that there's 2 plans for the BEAD program, and those were released and are now in an open comment period for everyone that is interested or has a stake in what we see with broadband infrastructure in New York State. Obviously, this has an implication on telehealth access. Then the second plan, which we've been very closely monitoring, is the New York State Digital Equity Plan. And this plan was created by the Connect All office, which has engaged statewide outreach to develop the strategies to increase digital equity in New York State. In the next year, a lot of funding is anticipated from the federal bipartisan infrastructure law. There's about $1.5 million for state capacity building nationwide, and millions of dollars will be allocated to New York State to address digital inequities. That plan was released on November 6th and is also in an open comment period through December 6th. This plan, I will put a link into the chat right now that will show you the press release, the full drafted plan, and then the link to submit any public comments. I encourage everyone to take a look at this. The state broadband office, Connect All, did have a health task force, which is included in the report. There's a nice section about what that task force discussed a lot in the way of telehealth, digital literacy for telehealth access, especially for different covered populations such as aging individuals, individuals with disabilities, etc. And there are 5 objective areas: broadband, digital literacy, access to device and device support, cybersecurity, and then access to public online resources. So take a look at that. And if you have any thoughts, if you think anything is missing that the Connect All office should consider adding to the plan, please feel free to submit those public comments. The state is really encouraging folks from across the state to add their thoughts in, and I want to ensure that the North Country is represented in that. There's also some regional snapshots from their statewide broadband survey, and the focus groups that were hosted throughout the state and listening sessions which we all took part in back last summer. So that was a really great opportunity to get involved. And right now, this public comment session is also another way to have your voices heard. So again, just take a look at that. And if you have any questions, please feel free to reach out. And then finally, just in the agenda, as always, I've included some upcoming telehealth related webinars and other opportunities. A few have since passed since I did publish the agenda, but there was a great session last week on telehealth and libraries, really talking about the digital equity needs, having sort of hubs throughout the community for telehealth access points and whatnot. Next week, the Connect All office will be hosting another state forum where they will be discussing the state digital equity plan. So you'll see that on the Connect All's website as well if you're interested in hearing directly from New York State on their process and the next steps for state planning in terms of digital equity. And then looking into December, more on the digital divide. There's a couple sessions, one from the National Library of Medicine talking about the digital divide, and then one from the Southwest Telehealth Resource Center on the impact of medical licensing on mental health and how telehealth is being impacted by state licensing. So feel free to take a look at the notes that will include all of the resources that we've discussed, the links to what's happening at the state level. And as a reminder, I'll be including everything that Tony described from CMS and the physician fee schedule for Medicare for 2024. We'll also be including some state updates that were shared back in September. And Dr. Collins, if you're okay with it, I'll also include a PDF of the slide deck if anyone wants to take a look back at that. I don't see anything else in the chat. I'll leave the meeting open for another minute or so if anyone has any questions for Dr. Collins, any questions about the notes that I had just described, or anything else about telehealth that they wanted to talk about. If not, I'll just say thank you again to Dr. Collins for her presentation. I hope everyone has a wonderful Thanksgiving. I know this week has been tough with the holiday coming up, so I anticipated a quiet group, but I thank everyone for joining us today, and you'll see the notes come through this week for sure. Have a great day, everyone, and thank you again.